Good afternoon, everyone. Thank you. And I am pleased to welcome our guest speaker for today, Dr. Manasa, MD Pediatrics, on application of telemedicine in children care. Dr. Manasa has done her MBBS from Narayana Medical College, Nellore, and her post graduation from Kempegowda Institute of Medical Sciences, Bangalore. She comes with an experience of over 5 years and is currently working as a consultant at Healing Touch Hospital, Secunderabad, Basant Sahani Hospital, West Maredpalli, Lifespring Hospital, Chilkalguda. She was one of the pioneers who has helped a lot of patients using teleconsultations during the pandemic that has occurred. Now, let me welcome Mr. Rahul Paith, who will be moderating for the day. Rahul comes with an experience of over 10 years and has mostly worked with all telemedicine companies and has a vast experience in consulting. His last assignment was with DocOnline as Chief Operating Officer and was the founding director of DocOnline. Welcome, Rahul.
Thank you everyone for joining this discussion. So just to start with, we know like COVID came and all this discussions happened, and after that, the telemedicine, which probably before 3 4 years was something everybody was questioning, and suddenly COVID has taught us like how to adopt technology and how to use technology and this means of communication to treat patients and how patients can get access to doctors. So to start with, my first question is that what was your experience in last 3 to 4 years, or to be precise, 2 to 3 years in your field of area? How you have seen that the adoption of the technology has evolved or increased, and what kind of patients are coming to you? And basically, what was your experience in terms of comfort, in terms of treating and providing care to the patients? So, yeah, Dr. Mansa, would love to hear your thoughts on those lines.
Yeah, actually, my experience is I think past 3 4 years post COVID era, to be very frank, okay, has increased this telemedicine more actually. Because during this COVID era, I mean, due to full of hospitals, due to infections, whatever might be the reasons, people were not keen in going, and all the chronic cases follow up were done through teleconsultation only. I think it has people have adapted to that right now. It is much more now.
Okay. So, like doctor, in terms of pediatrics, always the concern comes that the parents are always very concerned. Like they always want to see the doctor in person.
Yeah.
And for young kids also, like who is like 6 months old or 9 months old, those kids, they also can't share their problems. For a 5 year or 6 year old, the problem is a little bit different. So how you have seen that virtual care or this kind of platforms have helped you to do the consultation? Was it effective, or was the adoption good?
Yeah, particularly for coming to pediatrics, actually I feel it is like more of combination works actually. More of combination. And see, if they have any emergency at a point where they can't come personally, they can immediately consult us, and after that if they are not convinced, then they can go ahead with the physical thing. But I think that is also pretty good. Instead of waiting, they do take a consultation online, and they're doing it well. Adoption rates are very very good actually, even though it is infant. Because see, coming to infancy, usually infants are more prone to infections. They come out, they decrease their waiting times, and they're pretty adapting very well for that scenarios. I do agree with the point that mothers are very keen on pediatricians seeing them personally, but still on an emergency, on a need, I mean, like in an emergency hour, they're still opting for this teleconsultation. I think it is very helpful, but a combination of this, both virtual and physical, will do wonders actually.
Okay, sure. And also, doctor, like based on your experience,
Yeah.
do you feel like consultation is one part of it, but through technology, we can also educate new parents, like sharing articles or information and all these things? Do you think, like in pediatric care, also like other areas, like last week we had a discussion with a gynecologist, and she said like lot of questions, if we can, form a standard answer, because more or less if we go to 50 patients, the questions are more or less same.
Yes,
One or two
I
are
do agree.
different. So, do you think documentation or having bots answering those fixed questions, like where you as a doctor for your patients can actually create a set of answers, and that will help patients, larger population or larger percentage of the patients will be helpful for that, will find help out of it.
Yes, I do think it's so. Like, I mean, like, see, even I am a pediatrician, but still I am a mother. Usually, like, the concerns are pretty the same. Every mother has the same set of questions regarding the kids. See, but still, I mean, like, I think it helps 80%, but still, if they want to personally think, that 20% it will be there. I mean, like, that difference it makes actually. I think we can help out with 80%
Okay. And
with a
have you,
particular set of questions. Yeah.
right. And have you used or seen any such platform in the market today, like which actually makes doctors' life easier by asking or answering these questions or doing a proper screening before the patient comes for the consultation?
No, not it.
Okay, so it is just more like a connecting directly to the patient.
Yeah, it is like what they do, they usually share something like numbers or something that and all. Like, they don't take a proper history, nothing. Like, what you are writing right now, putting in front of me, is like a newer platform actually. I think it
Right.
would be of great help for both patients and doctors if you're seriously doing that.
Right. So I hope that Medley team takes a cue out of it and they build something on similar lines. In
Yeah,
terms,
that would really be helpful for a doctor.
right. And doctor, like even like I have a kid who is not infant anymore, but at least like I remember like going to hospitals and we used to carry like bunch of files always, like
Yeah.
from the first 6 months to like till he was 5 year, like we were carrying all the files, and it was like a mandate for us at home to maintain those files.
I
With technology like EHR and those things have playing a major role. So are you seeing that in current day technology, EHR is evolved in that way that, you're seeing that patient data is properly secured and kept somewhere. So when you are doing the consultation, you are referring maybe 3 months back history and all these things. Are you seeing those kind of platforms today?
Exactly not, actually. Exactly not. And I think even this teleconsultation will help us with that. See, what happens with pediatrics, especially, they need something. We in particular are very particular, starting from newborn till the age of 10 or 12. Usually, they visit a pediatrician till this age, as far as
Right,
I am concerned. See, as far as I am concerned, I want everything in detail. See, you might miss on some vaccination. Okay, but if you have a detailed history, that I think teleconsultation will bridge that gap actually. See, I have so many patients who miss on their documents.
right,
So many times they don't give a proper history, because it happens like sometimes grandmother knows something, mother knows something, and they keep missing. One visit mother does, one visit grandmother does. So
right.
I think it would be helpful if we have everything as a documentation. I think teleconsultation will bridge that gap because we have all documentations there.
Right. So apart from that, I'm just asking, a separate question, which is little bit extension of telemedicine. Like I asked you regarding EHR, which is the electronic health record. You mentioned like it will definitely help if technology helps to maintain the record. But
Yes.
there is a new stream of telemedicine, which is like as an extension, which is coming out in the market that is called teleradiology,
Yeah,
where
I heard it. I heard.
Right. Where people can do the scans and other things like beyond pathology, like the radiology reports, and they can share the, those reports with the doctors directly, the raw scans, and through DICOM facility, the doctors can see it. So, have you experienced or have you seen any such platform in the market
No,
today?
no.
Okay,
No. And I think that would save a doctor's time like hell. I mean, like, it would be really helpful if such platform is being offered.
great.
So you can sit at home, you can access all the reports, you can just talk to the patient then and there. They would be very relieved. I mean, like, see, what happens in outside practice is patient just comes, gets admitted. Okay, the reports takes around 20, I mean 24 hours. Some do even take 48 hours. So most of the mothers or fathers concern is why are the reports very late, and they come somewhere in midnight, doctor won't be available. So I think all this would be bridged with this, what you told actually. At any point, we can contact them. At any point, we can see the report and we would be relieved. Patients would be relieved. I think that is really good.
Right. Wonderful,
Are
doctor.
you planning? If you are giving that, I mean, it would really help the patients actually.
Right. Absolutely. So now coming back to your individual practice, and this technology is always, we understand, helpful for the patients, but as individual doctors like who are practicing, doctors interest, many of my doctor friends, they always have this query like how it will help them to increase their practice or increase their reach. So you as a pediatrician or personally, have you seen that your patient base has increased in last 2 3 years because of technology? Do people reach out to you from different states or even outside India, or which was probably not possible previously? Do you feeling that difference?
Yes, I do feel the difference actually. I mean, like, I have a set of patients who call me from Lucknow actually.
Okay,
That was possible only through teleconsultation. And I have one patient who calls from US actually. I
okay,
know I just can't do the prescription, but at least they rest assured, at least speaking to the pediatrician from India, because their mode of treatments, everything is different. But I think this technology has improvised that, definitely.
and so as an experienced pediatrician, what suggestion you will give to young students who are right now going through their MBBS and other things? Do you think technology is becoming a challenge for the doctors and they should learn few things which will help them, like who are probably 10 years down the line, like who are probably in the first year or second year of their MBBS? For
Yes.
those kind of students, what is your advice?
See, my advice from my side would be, I mean, like, down the lane, the practice is going to be a mixture of both. That is what I feel actually. It is going to be hybrid. I think they should be well versed with even technology and both. I mean, both physical and technology. And even that helps them also, actually. I mean, only physical won't help. See, sometimes we do miss out on patients. Like you are running out of time, something like that. But online, we never miss anything because it is like everything is documented, everything is at your hands. I think it should be a mixture, and I do recommend that they practice both down the lane.
Right.
I mean, like, they should be a bit better than us.
Right. So that is like for the next generation of doctors.
Yes, they should definitely be better than us, and I would recommend this teleconsultation over anything else.
Right. So, but what you think was the major challenge for doctors who are like pediatricians who are 10 years experience today in the market, or who are 20 years experience, while adopting this technology, what was their main apprehension that from that the younger students can take a cue that our seniors probably struggled in those lines because they didn't get that exposure, and probably we can actually learn those things faster or
Yeah, I think using technology was a major challenge for them. I mean, because they were not used to all this. First point is that, and I think they didn't have enough good platforms. I mean, like we, whatever we have, even we don't have enough platforms. I think we need some upcoming very good platforms actually.
sure.
I think
So,
that is a major setback, is what I feel. I mean, like, Indian scenario, I think we need very good platforms for teleconsultation actually. Like, our previous, I mean, post pre-COVID era, I don't think we had many platforms for this teleconsultation, and it was never a thing. I mean, even though ministry was very insistent on that, but it wasn't actually. It was like around 5% teleconsultation. I think post COVID it emerged to it has risen up to 47. And
right.
one thing is, doctors are also were not very keen. I mean, they felt at the first point, I mean, my seniors, everyone, like, how do we take this without a physical examination? But after COVID, no, everyone's thought kept changing. I mean, like, in an emergency situation, see, there are so many chronic conditions like asthma, diabetes, all these, I mean, don't need right now examination. I mean, like, they just need some visits, that's all. So all that can be taken ahead. I think major challenges were, initially they didn't have documentation, which now we are maintaining through these platforms, and they didn't have that access to technology. This is what I feel. I
Sure.
think that once that is bridged, no, I think this should do wonders actually. I mean, we need some good platforms. We need them more actually.
Right. And do you see like when while during this COVID times or now also when you were using this technology, have you seen like there was a good number of people from rural places, like they are also using and reaching out to you or your fellow doctors from rural places, like villages, like where they don't have doctor
Rarely.
access? Rarely.
Rarely. I think they need, those people need, I mean, like they need to get aware. I think we need some webinars. We need to go to them and explain what's happening in detail, because they have more urgency than people staying in this metropolitan and grade 2 cities actually. Rural is less. I mean, some educated parents, whoever stayed in rural at that point, they somehow propagated, and that was how I received. I don't think per se rural people would have called me. I mean, some people who stayed in Hyderabad, example, they went back to their villages at that point. They created some awareness, the software people. I think that was the reason some rural people have called me back. But I think they need to get adopted for all this. I don't think there is still awareness among those people.
Right. Sure. So, since we are talking about the rural, this is the last point. I just want your thoughts. Like every doctor, you also might have spent initial some time in the rural areas in PHCs or CHCs.
Yes.
Right. So this is a very standard thing. So nowadays, with a lot of government initiatives, even with government of Telangana, government of Delhi, a lot of governments are doing it in terms of a lot of mohalla clinic or primary health centers, which are converting into tele health providers.
Yes.
So there, like we have seen that a lot of people are coming, and they're keeping some nurses or RMP doctors or those kind of people who are like a intermediator, like playing the role. So doctor is
Yes.
probably sitting in Hyderabad, speaking to them and asking them that measure this, measure that, and they are just doing the measurements and communicating with the doctor, and the patient is sitting. Do you think this kind of practice will be effective in the cases of pediatrics? Because they're like the kids are really young, and I'm not sure how well the nurses are trained for that in those areas. So, do you think there is still a scope or some help can be provided if such centers are activated with pediatric services?
Yes, I mean, like, I am not very keen on some untrained person seeing a pediatric case. I mean, like, see, because pediatrics is a branch which is completely different from your adult. Because all these RNPs or the nurses, all of them are well trained. Probably they might pick anything abnormal in adult. But pediatrics, everything has an age and weight specification, including whatever you check, including your heart rate, respiratory rate, everything. So I think we need a trained personnel, particularly in pediatrics, to bridge that gap. Otherwise, it won't work. I mean, like, see, what I feel is anything. I mean, any wrong information might be as long as bad as like not giving any information.
Right.
So I don't think it would help it. I mean, like, particularly for a department of pediatrics,
Right.
you need very good personnel. I mean, very well trained personnel.
Correct.
This is what my opinion is, and I am also very keen on that. See, trust, to be very frank, I mean, like, the doctor who has finished MBBS, okay, he might also not be very good at handling a pediatric case. They also should have an experience of working in a pediatric hospital. Even the sisters, anyone whoever is bridging that gap of informing it to a doctor, I think they should be very well trained, especially for pediatrics.
Which is a challenge in this rural centers.
Yes, it is a very big challenge in rural centers. Yeah,
Because
that is the reason we have more number of emergencies coming from rural setups. I mean, what do we say? Like, they are not picked up early because they don't have enough trained personnel. This is what my opinion is actually.
Right.
I think for pediatrics we need absolutely trained persons, and there is no compromise on that.
Right. So this is a good information, doctor, and good learning, because we see like a lot of PHC centers are coming up, and other specialty doctors are comfortable treating patient when a RMP or a nurse is there and are doing the basics. But I think this is a challenge or a gap in the area of pediatrics.
Yes, pediatrics it is.
Right.
Thank you everyone for joining this event, and hope you've got good insights from whatever discussion that has happened. Thank you.